I did not realize that it would spread as extensively and continuously as it did.
At the time, it hadn't even really sunk in what was going to happen or what was going to come about.
We wanted to know, is this virus here within our community? What virus is it? Where did it come from?
Sequencing has been an essential part of understanding how the virus evolves and making sure that we are a step in front of the virus and not behind.
Every single virus basically has this genetic fingerprint. So it's a group of mutations that's kind of unique to that virus. And so sequencing allows you to kind of see that genetic fingerprint.
We can very quickly find out what something new is and then start to develop vaccines and drug treatments against it. It's kind of like a weapon in the arsenal that we have against infectious diseases.
Sequencing has been crucial for the COVID response. If we did not have the first sequence as fast as we had, we wouldn't be where we were today.
In one single day, the virus can catch a plane from one part of the world to the other. You need this joined up approach like the Arctic network that aims to provide an end-to-end system for genomic surveillance. Sequencing of SARS-CoV-2 is now taking place in over 100 countries in real time.
The Minister of Health here in Kenya put a raft of measures that included locking down transport, international air travel. Our capacity to run sequencing of SARS-CoV-2 has gone on to inform some of the control measures.
So nanopore sequencing has been the workhorse for us generating sequence data. We looked at how the viruses were spreading differently through different parts of our state. In Dane County, there seemed to be multiple introductions of the virus coming into the community, whereas in Milwaukee, there seemed to be a rather early introduction of an Asian lineage virus spread throughout the community. In Dane County, it was really important to limit travel, whereas in Milwaukee, it was more important to work on measures to reduce person-to-person spread.
We were able to see that healthcare workers were becoming infected through the community rather than patient contact. So that meant that infection control practices were working.
Nanopore sequencing could be used quickly and very accurately. At the time, there was no coronavirus circulating within the community in Sydney, and genome sequencing used to solve the likely source of one of these mystery cases. A hotel quarantine worker was infected, but we were able to show that the likely source of this case was from a US aircrew. We knew the source, and it meant that it was unlikely that there was a large number of people exposed, and what that meant was that the New South Wales government did not have to impose strict lockdowns.
In Denmark, it was really an important moment, the first time we discovered B117. But ever since middle of December, we've been tracking it and has been able to follow it from basically nothing to now 50% of all cases in the society. Right now, we see that the government is using our data we generate actively to take decisions on lockdowns and how to open the society again.
The proudest moment for me has been to help facilitate sequencing of coronavirus in the Philippines, where we'd trained the team there, we'd put the resources in place to allow them to do the sequencing.
This will not only be beneficial for the country. Being able to generate more data will mean more data we can share to the world, and thus it will be very helpful in a global pandemic response.
I think the sequencing of SARS-CoV-2 genomes has really shown the hospitals and the government what we can do with modern sequencing technology today.
Policymakers and the politicians really embraced the role that genome sequencing can play in Australia's response to coronavirus.
The past has shown us that humanity can survive all the plagues and pandemics that the world had endured.
The absolute scale of data that's been produced and shared publicly around the world, we've never seen this before. All hands are on deck with this pandemic, and I am hopeful and optimistic for the future.